We got a new analysis from the University of Washington that indicates more than 900,000 Americans have died from this virus. So it's almost double what we were able to track. Just your overall reaction and what does this tell you about our ability to sort of track this virus that we may have undercounted by almost 50%?
You know, we've been saying, and the CDC has been saying all along, that it is very likely that we're undercounting. You know, the model says that it's a significant amount, as you mentioned correctly, 900,000. That's a bit more than I would have thought the undercounting was. But, you know, sometimes the models are right on line. Sometimes they're a bit off. But I think there's no doubt, Chuck, that we are and have been undercounting. What that tells us is something that we've known. You know, we're living through a historic pandemic, the likes of which we haven't seen in over 100 years.
Dr. Fauci was ripping off a study from the University of Washington. They looked at excess deaths, excess mortality in the U.S. and the world, basically for the last 14 or 15 months, and came up with the number that U.S. deaths are really 57% higher of COVID than reported, and for the world as a whole, basically double the official toll. So, you know, to the extent that they've run these numbers through their epidemiological studies, you know, I think there's a lot of validity to them. And we know that countries like Mexico recently re-reported their excess deaths way higher than they had been. And one thing that the University of Washington said is that they specifically mentioned Japan, Egypt, and some Central Asian countries, saying that those countries' coronavirus deaths could be 10 times their officially reported numbers. So it really is quite sobering. I mean, at some point, 3 million, 6 million, 7 million, they're just massive numbers, and we've reflected on that many times over the past few months.